I wanted to answer this specific question in a video because I think it will help a lot of other individuals that are in a similar situation. So in my Facebook group, a member asked, quote, "I'm 7 months post-op and I still have knee pain if I walk too much. Still need a walker or a cane most of the time. When should I start to feel normal again?" So that comes up a lot. It could be 3 months, 6 months, 12 months. I've got individuals that are 2 years after their knee replacement surgery and they're still experiencing something very similar. I would say at this point, if it's 7 months post-op, you really need to have a professional back involved. I'm not sure if you're still seeing a physical therapist or not, but if you're not, I would recommend you do. I would recommend that you've probably reached out to your surgeon, but if you haven't, you should. Most of the clients that I work with that are, more than 3 months post-op and still frustrated with their improvement, they've usually already spoken to their surgeon. The surgeon has usually already x-rayed the knee hardware is intact. There's no sign of infection. There's no sign of instability. Like from outside looking in, everything appears normal. But as the patient, you understand that there's something going on. You understand that you're still in pain, you're still limited, you're not able to do as much as you want to do. And that's a situation that really takes time and deep investigation. That's where I would encourage you, connect with a physical therapist, even an occupational therapist. They do an amazing job as well. If you had completed your post-surgical recovery, you've been discharged from therapy, talk to your primary care doc or your surgeon to see if you can get a new referral. Work with either the same or a new physical therapist. Sometimes having a new set of eyes, a new personality, looking at the problem can bring you some new advice and new information. I am a physical therapist. I treat a lot of patients for the first time after their knee replacement, but I also see a lot of patients who have been to other physical therapists. The other therapists have done a great job. It's nothing against them, but patients will come to me for a different perspective. And I promise you can find a therapist in your community, within your insurance network, or on a self-pay basis that can provide you that alternative perspective to see maybe there's something else going on. A lot of times when I'm working with somebody who's had a complicated recovery after knee replacement, we're going to be looking at joints above and below. We're going to look at the ankle, the foot. We're going to look at the hip, the low back. Sometimes we're going to look at other non-orthopedic issues. Like sometimes there might be an autoimmune condition that's going on. There might be hormonal changes that are affecting the recovery process. There's just a lot of stuff, a lot of things that could be out of whack, that you want somebody who can look at the big picture, can compile all of the previous history, and help guide you in the investigation process. Because that's what it is. It's an investigation. You're trying to figure out, why did I not improve like other people at 6 weeks, 12 weeks, and beyond? Guys, I hope that helps. Go find a great therapist, somebody who you can work with, who you can trust, and I'll see you on the next video.